Hello, everyone. My name is Jay Nichols. I am Vice President of Public Policy here with the Trust Association of America. As always, Olivia Woodrich, our policy coordinator, has joined us, and we are using this opportunity to just give you some basic instruction on our 2025 Congressional August Recess Toolkit. As always, we're going to walk you through the process of how to schedule meetings and provide you with all the appropriate background. And we will, as you know, leave our contact information, and as we are always available to help. I think it's best. Here's where we'll begin. Just to give you a little status of this current Congress. So, today being July 31st in the afternoon, the Senate is actually still in doing some work, and including marking up a draft budget bill that will include proposed funding levels for our federal agenda, which we'll detail in a moment. And so we were hoping to see them by now, but considering that the Senate is going on recess at the end of the day today, the House actually went on recess last week without doing any work unfortunately, not doing any work on next year's federal budget just as of yet. So they are going to be home through Labor Day. And most members of the House are going to be back in their home districts and their fellow senators in their state. So this is always a great opportunity to kind of use this momentum that we started building back in March when many of you were down here for a day in the Hill, and just to follow up with them and their staff, and just to continue advocating on behalf of TAA's 2025 federal agenda. And as always, this is our agenda. From the funding standpoint, our number one priority is the public health education and research program that's housed at the Centers for Disease Control and Prevention. We also, as the TAA is chair of a coalition on the National Center on Birth Defects and Developmental Disabilities. We also support full funding for that office at the CDC and the National Institute of Health and Institute of Neurological Disorders and Stroke and the National Institute of Mental Health. We support, since there's a lot of alignment in our work and the work that those offices do. We continue to urge Congress to continue funding them at the highest levels possible, and then funding for telehealth, which is currently set to expire on September 30th. We just want it to continue to be extended, hopefully for a couple of years, instead of trying to do this every 6 months. We would like to see a bipartisan effort just to maybe do it for the next couple of years, so we don't have to always come back and revisit a potential looming deadline. Before I hand off to Olivia, I just want to briefly summarize how things will look once they do return in September, and how things will go until the end of calendar year 2025. So the federal fiscal year ends every year on September 30th, and we are currently operating under fiscal year 2025, which was finalized back in March. Basically funding everything as it's been funded for the last year or two, which overall is good. There was no cut, but we are hoping that this year they can actually get an actual legislation done. But they won't get it done by October 1st. So what is very, very likely going to happen is you're going to pass what's called a continuing resolution that will avoid a government shutdown and keep all programs funded. Cannot say for sure what the length would be, but historically, especially with new administrations and new Congresses, like in year one, they usually reach a final deal on a budget right around the holidays, but by mid to second or third week of December. It could still go longer than that, but we anticipate the earliest the budget could possibly be done for 2026 would be closer to the end of the calendar year. And as always, there could be bipartisan legislation that could be attached to this final budget. That's usually what happens. Many bills that get passed, they usually ride on the annual federal budget. And so there are a couple of priorities we have right now that could possibly be possible candidates. So that's where we currently, things are currently going to play out for the remaining 5 months. obviously a lot of work to do, and we obviously want to keep you involved as possible. So I'm going to pause, and I'm going to actually hand it over to Olivia, and who's going to actually dive in a little more specifically, more specifics into what our federal agenda is.
All right. Good afternoon, everyone. Thank you, Jay. So our congressional asks are the continued support of 2.5 million in funding for the public health education and research program on Tourette syndrome at the Center for Disease Control. TAA is a proud partner of the CDC and the Tourette Syndrome Public Health Education Program. This program is designed to reach parents, educators, pediatricians, physicians, and other healthcare workers as a part of a campaign to increase scientific knowledge on the prevalence, risk factors, and co-occurring conditions. Our second ask is to join the bipartisan Congressional Tourette Syndrome caucus led by Congressman Steve Cohen and Representative Andrew Garbarino. You can go on to the next slide. Our next congressional ask is to support the full funding for medical research at the NIH and the National Institute of Neurological Disorders and Stroke, and the National Institute of Mental Health, the National Center on Birth Defects and Developmental Disabilities, in addition to support the extension of telehealth coverage beyond September 30th. Our next ask, of course, is to co-sponsor the Safe Step Act when it is reintroduced. The reintroduction of this bill is expected sometime this year. Last Congress, the bill had overwhelming bipartisan support, and this legislation would improve step therapy protocols and ensure patients are able to safely and efficiently access the best treatment for them. Last but certainly not least, we ask that these legislators will co-sponsor the Improving Seniors Access to Care Act. This bill is sponsored by Senators Roger Marshall and Mark Warner, along with U.S. Representatives Mike Kelly, Susan Delbane, Amy Barra, and John Joyce. And ultimately, this legislation would expand Medicare beneficiary protections and improve enrollee experiences and outcomes. So with that, I will throw it back over to Jay.
Thanks, Olivia. And yes, for the last two bullets you all see there, the Safe Step Act and the Improving Seniors Access to Care. As Olivia mentioned, there was a lot of very strong, if not overwhelming, bipartisan support for both bills in the last Congress. There was actually, the plan was to actually include both of these pieces of legislation to a year-end bill from last December, and it looks like it was on its way to getting both of them done. But unfortunately, there was a bit of a blow up in the House of Representatives where they didn't want to have a large funding bill or a large legislative measure sent just before the end of the last administration, the last Congress. So the only thing they were able to do was to really just pass a bill that just kept the government funded for a time being. So that was unfortunate, but we're hoping that this Congress, we can actually get it done. Negotiations are certainly remain ongoing, and we'll keep you all in the loop on its progress. So the toolkit will be live by August 1st, which is tomorrow. And it will include all background information, more in-depth information, everything Olivia and I have discussed, as well as some talking points to help you in your meetings. We love to use this opportunity to try to make a more public showing and public support, and some ways to do it, depending on where you live, could be a possible letter to the editor. And we've included a template that you could just add your name to, or whatever you'd like to. And then, as always, we do include an email that we recommend that you send, since usually office protocols for elected officials, especially at the federal level, if you would like to meet, they ask that the request be in writing as opposed to phone calls. And so we want to, kind of just, we strongly just recommend you just use the one that we at TA drafted for you. And down there is the URL. And as said, by August 1st, this will be live. And what is the best way to kind of schedule your meetings? So I'm going to use my congressional delegation as an example. I live in Arlington, Virginia. My congressman is Donald Bayer, and then I have Senators Tim Kaine and Mark Warner. The simplest way to get to a state and or local district offices is to go ahead and visit the website that we highlight on the left side here, congress.gov for members. And when you get there, you enter your zip code. And once you do that, you're going to, what you see on the screen right now is you're going to see something similar. All what you do is you then click on each member, on their photo, on the representative or senator's photo, and it'll take you to the member website. And when you scroll down, and this is usually right on the home page, you don't have to kind of navigate or surf through certain links. There should be both a Capitol Hill office and then its district office. And for the vast majority, if not all, of House members, they usually just have one district office, and it includes the contact information. It may even have a general email address with some of it as well. But for the most part, you probably would, you may just want to call the number that's listed. And when you do, you want to ask for the email contact of the staffer that handles meeting requests. This could be kind of like a manager, but it could also be somebody who handles all the issues as well. Staffing is a little different at the local level than it is at the federal level. We're here in Washington, D.C. They have multiple staffers that handle certain issues, and then they actually have a staffer that's solely responsible for handling the elected officials' schedule. But at the local level, they have far fewer staff who wear many hats. So when you do contact, just ask them for the contact info for the meeting request. Now, when you do get your meeting scheduled, the first thing we would like you to do is to please let us know, because Olivia and I will be serving at your service. And if the meeting is virtual as opposed to in person, we would love to join you and provide you with support. If it is virtual, before the meeting actually happens, please email them the fiscal year 26 budget and legislative one-pager before the meetings. And if it's in person, we then recommend if you could just print them off. And once again, these are all going to be on our main webpage for the toolkit, and then just physically hand them to the member and or staffer during the meeting. And when the meeting concludes, please ask for a business card, and then shortly thereafterwards, please send just a very brief thank you note, thanking them for their time. Just a couple of reminders here as we kind of close things up. It is really best to never be political in any of these meetings, even if the staffers themselves might start speaking in a political fashion. So we just recommend that you don't really talk about politics or even upcoming elections. or even when it comes to political contributions in a legislative meeting. In fact, staff are strictly prohibited from discussing the very last item we just mentioned. Your time is going to be limited, depending how busy they are. So please stay on message. And the information that we've highlighted that we recommend that you really focus on should be helpful there. Please, never videotape or record any of these meetings. And if you would like to, and we would encourage you to do this, we would love to see group photos. Please ask permission first, and then just for the photo, and then please ask permission if we at TAA could actually share the photo and thank the member's office for meeting with you all. And then, as we mentioned, please follow up. There could be items that could be requested that you may need to coordinate with us on that we can help send, but you do certainly want to follow up if it's needed shortly after the meeting, or else staff may forget. Like we mentioned, they're always busy all the time. And then, just so you know, these meetings tend to last maybe 25 to 30 minutes. So please make the most of it. And we really, thank you for your time. And we're here to give you a hand. Here is our contact information. And lastly, once again, here is the toolkit, which the link should be shared with you electronically by the end of this week. We are really, really excited to continue, working with you all, and really would like to, we're here to help in any way we can to make sure your meetings are a success. So with that, we thank you, and we hope you have a great rest of your summer, and we hope to hear from all of you soon on just how well your meetings went. Take care.